Hey. Hey. Un momento. Trying to get my comment to pin, but it's not working. So let me type it out for y'all. I don't know why it's not working. Hope everybody's doing well. Just give me like a minute or two to type this information that I want to share with you all. I'm pretty excited about today's topic. So if you have any questions as we discuss, feel free to drop it in the comments, and I'll do my best to answer those questions. Once again, I'm excited to talk with you all. I love being here. It's my favorite day of the week, Tuesdays. And even when I'm having technical difficulties. All right. A little bit longer. My fingers are too big for this phone. It's taking me, I'm fat fingering the keys. There we go. Thank you, No Filter DC, for posting it for me. All right, that works. All right, now that we got that pinned, we'll get into the topic. All right, so gotta give my spiel at the beginning, and then we'll jump into today's topic. So, as you all know, over the past few months, Whitman-Walker's Community Health Department has expanded its outreach efforts to social media. We cover various topics about HIV, STI sexual health practices, access to care, social determinants of health, and general public health interventions. Our series of outreach sessions also focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to help and educate and support you. So just know that we're here. As some of you may know, Sunday, February 7th was National Black HIV/AIDS Awareness Day. The first National Black HIV Awareness Day was marked in 1999 as a grassroots education effort to raise awareness about HIV/AIDS prevention, care, and treatment in communities of color. The Strategic Leadership Council plans this event each year. It is a day to increase awareness about comprehensive HIV prevention strategies, especially those in Black communities. National Black HIV/AIDS Awareness Day commemorates the profound impact of HIV/AIDS on Black individuals in the United States. This year's theme is We're in This Together, which highlights the importance of social support from friends, family, colleagues, and our partners. When addressing HIV in the Black community, remember, we're in this together. This promotes the idea that we all have a role to play in ending the HIV epidemic. This observance is an opportunity to increase HIV education, testing, and community involvement and treatment among Black communities. So, you're probably wondering, why is this day so significant? Well, in 2018, Black Americans accounted for 13% of the population in the United States, but 42% of all new HIV diagnoses were among Black Americans. Among women, 50% of those new diagnoses are Black Americans. 40% of the 1.2 million people living with HIV in the United States are Black Americans. HIV/AIDS has a disproportionate impact on Black Americans and those communities of color. Specifically in DC, those who were newly diagnosed with HIV, 48% were Black men and 25% were Black women. The prevalence of HIV among Black men and women in DC is extremely high compared to other populations. For example, 0.1% of white women who reside in the district are living with HIV, compared to 1.7% of Black women living in the district. 1.4% of white men who reside in DC are living with HIV compared to 4% of black men. On top of all of this, black Americans also face an extreme wealth disparity, which includes high rates of poverty. What does this mean exactly? Because of these systemic financial limitations, black Americans are faced with limited access to high quality health care, limited access to housing, limited access to HIV prevention and education, etc., etc. All of these things contribute to health outcomes, or should I say poor health outcomes in the black community. Socioeconomic status and these issues associated with poverty can directly or indirectly affect the health of people living with HIV and increase the risk for new HIV infections in black communities. Limited access to prevention, care, along with stigma attached to these things and additional social factors negatively influence the amount of black Americans that are getting tested and treated for HIV. It's a lot, right? 1 in 7 black Americans living with HIV are unaware that they have it. 39% of black Americans with HIV do not receive care. So what's the bottom line here? We need to improve access to care and prevention and normalize routine HIV STI testing. This is why I'm here. This is why I do this work. This is why I come on every Tuesday to talk to you all. Black people face barriers to care. Whitman-Walker is here to help prevent those barriers any way that we can. One of the barriers that we do have access or help prevent is PrEP. PrEP medications can help prevent HIV and can help reduce the impact on the African American community and other communities of color. PrEP has been identified as one of the most effective strategies to prevent new HIV diagnoses. It is encouraging those who are at risk to take pre-exposure prophylaxis, PrEP. It's a daily medication that lowers their chances of an HIV infection. The use of PrEP has increased significantly over the last several years. I'm actually a PrEP user myself. However, important disparities in PrEP still exist. According to the CDC, only 5.9% of black individuals who were at risk for HIV in 2017 were receiving PrEP, compared to 42.1% of white individuals. This significant disparity in PrEP use illustrates the need for comprehensive strategies to increase access to and use of PrEP, especially in black communities and other communities of color, or other communities that are disproportionately impacted by HIV. If you are looking for more information on testing, PrEP, and other prevention, or any HIV treatment, Whitman-Walker is here to help. You can give us a call anytime at 202-797-4439. All right, that was a lot. Are there any questions? Again, the bottom line here is that, black communities are disproportionately impacted by HIV. And we're doing our best here at Whitman-Walker to help reduce those barriers. We want to also get input from communities that if you're part of the black community. So we have several resources available. You can check out our website at whitmanwalker.org, or you can reach out to me directly or one of our other community team members, and we will help if we can. I also want to point out that in 2019, an estimated 38 million people around the world were living with HIV. Many of those people don't know their status. They can't access care and therefore will have a difficult time preventing the spread of HIV. So I want to encourage everyone who's tuning in right now, everybody, if you can bring in a friend, we are all here to help, communicate and make awareness around this particular subject. HIV education, stigma reduction, and HIV testing in black communities, we can help improve this. So I want to remind you all that we're in this together. Let's do our best and do our parts to help reduce the impact of HIV in black communities and other communities of color. I want to thank you all for joining. Again, I have a few reminders for you all. Whitman-Walker is open for HIV, free HIV and STI testing. That is by appointment at our Liz location in Northwest DC. as well as in our Max Robinson Center location, which is located in Southeast DC. You can make an appointment by calling 202-797-4439. I also want to remind you all that we are still in a pandemic. So, social distancing is still the best way to reduce the amount of COVID-19 transmission within our community. It deliberately increases the space between people to avoid spreading the illness. So make sure that you are continuing to stay at least 6 feet away from other people when at all possible. Wear a mask in public. Avoid places that have large crowds. Encourage work from home if you can. Also, if you want to speak or communicate with your loved ones, let's try to do that over FaceTime, Zoom, whatever virtual medium that we have available to us. Also, stay up to date on local, state, and national guidelines for testing, quarantine, vaccine distribution, and general safety. And lastly, washing your hands for 20 seconds at a time is still extremely important. And please, 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 please stay home if you do not feel well. Social distancing is still the best way to care for your community right now. All right. Lastly, follow us on Twitter, Instagram, Facebook at Whitman-Walker, as well as at Real Talk DC _. You can also follow me on Instagram at Sir_Dave_, and visit our website at Whitman-Walker, well, it's not at Whitman, Whitmanwalker.org for more information and to stay up to date. I hope this was I hope you received a lot of good information from today's session. If you have any questions, feel free to drop it in the comments. But otherwise, I hope everyone's staying safe. I hope, you are doing your best. Continue to tune in with us. We have so many other sessions that's coming up this week. So, feel free to join us. And I will see you all next Tuesday. Have a great day.